Awesome. Well, thank you guys for being here. So, with this pandemic going around, there are so many things, so many issues that people have been super overwhelmed with. And now what comes into play, especially, is that of women's health. Um, you know, this is a great opportunity for a lot of people to just take the time to really think about these issues and take very detailed notes on everything, especially from experts like you guys. So in your opinion, what is the biggest factor leading to period poverty?
Ashka, would you like us to introduce ourselves first?
I'm so sorry. Yes, please. My name is Ashka, but of course, go ahead.
So I'm Elizabeth Melendez. I go by Liz, and I am an obstetrician gynecologist in Portland, Oregon. And Autumn.
Yeah, hi. My name is Autumn Davidson. I'm also an obstetrician gynecologist. I go by Autumn. I work as a generalist mostly, but I also have a specialty working with family planning. So I do a lot of work around reproductive justice issues, and this comes up now and then in the work that I do.
This is awesome. Talking to you guys right now, I'm just super inspired because I want to be you, like, so badly. Like, my entire life has been, I want to be an OBGYN, but that's awesome.
That's great. Yeah, it's a great career, and I'm sure you'll thrive in it.
I think I'm really excited. Currently, there's so many issues going around, right? So, like, this is like a very good time for me to just take some energy and some focus and just put my all into just getting there into my goal. So fingers crossed for the future, especially with this pandemic going around, right? I hope you two are doing both well.
Thank you.
Yeah, thank you.
So in your opinion, what is the biggest factor leading to period poverty?
I can start. I think, Ashka, I would probably split that up to period poverty in the United States versus in other countries that are probably of lower socioeconomic status than ours, because I think the contributing factors are very different. So whereas countries of lower socioeconomic status probably have issues around access to running water or hygiene issues, that those might be different from what we in the US might encounter around period poverty. When I think about US contributing factors, I think about myths and cultural differences and communities that are marginalized, whether it's young women who are houseless or young women growing up in communities of color who may have cultural norms that really ostracize these young women as they begin menstruation. And so then these young women are limited in terms of their access to knowledge and to the tools that can help them navigate just society once they enter into those menstruating years. So I kind of think of that period poverty in two very different sort of physical barriers and sort of cultural barriers.
Of course. Dr. Davidson, do you have any input?
Yeah, I mean, I would very much echo what Dr. Melendez said. I know that in many parts of the world, women are, or young women, adolescents, girls are defined in many ways by when they have and when they don't have their periods. In places where people can't afford or there isn't access, like Dr. Melendez was saying, to running water or to sanitary products, be them disposable or reusable, women and girls are often not able to go to school. There are many cultures where women are not allowed to participate in general activities or be around men. And I think that that can be in many ways devastating and a huge interruption for their education. And we know that education for girls is one of the most important things that we can do for general social health, for our environment, for reproductive justice. And so the interruption of that monthly by the mere fact that people are bleeding and don't have access to what they need for in order to manage that and to stay clean and out, not having to worry about going to school and to bleeding. All of that can be hugely, hugely detrimental for the individual and by extension for the society. And so I think pure poverty, it manifests in so many different aspects of people's lives, but it's one more way and one more example of how women can be particularly marginalized by poverty. And I think that is mostly seen in developing countries. Here in the United States, again, it's very, very hard to generalize because we have such a diverse culture and we have so many different environments in which girls are raised. I would say clearly we have many fewer people, I think that don't have physical access to staying clean, although I do think that that is certainly an issue for many people in this country. But I'd say for the majority of girls growing up in this country, we have different issues. We have the objectification of people's bodies. We have sexualization of young girls. We have social media that propagates ideas around that focus and define young girls according to the way that they look, according to their reproductive potential. And all of that messaging and that culture goes into people being very nervous and not having true knowledge about their periods and what that means and their likelihood of getting pregnant and all of that. And so I think that there's a lot of misinformation that people, girls in particular, receive, and a lot of, like Dr. Melendez was saying, a lot of mythology that is propagated on a lot of it, on social media that can be very detrimental to just an individual's ability to control her own reproductive life.
Which is just so frustrating, especially living in such a progressive country. Going back to the culture statements, I definitely relate when you two both said there were so many boundaries. Coming from like a South Asian background, there are a number of boundaries and a number of barriers that surrounds this taboo as a whole. But with that being said, how do you two as physicians see yourself play in that kind of role? How do you see yourselves as physicians try to fight against period poverty?
So Ashka, I take this back a little bit further in my own background. My family is Mexican American. I grew up in South Texas in a heavily Catholic community where the idea of even something as simple as using a tampon was just anathema to being a quote unquote good girl. And so even within my own generation of girls having to exit sports or cheerleading or any kind of activity because of embarrassment that you couldn't wear a big fat pad while you were participating in these activities meant you just didn't do them. And so it's one of the drivers that led me to enter OBGYN as a career. Really, it started at that early age of just feeling the injustice of, how is it possible that because I want to use a tampon so that I can continue cheerleading, that I can't, that is not allowed in my community, in my family. And so I sought to sort of be a women's health advocate, and I really decided early on that it was what I was going to do, not just for the sake of promoting the use of tampons, but also for just education in general and being able to speak to the taboos of a menstruating, woman, a menstruating young girl, and what that means in terms of sexuality. I also came from a background of being the product of a teen pregnancy, and grew up in a community where the teen pregnancy rate is unacceptably high for a country as rich as ours. And so just really wanting to educate and sort of serve as an example of you can overcome this. There is opportunity. You just have to seek it out. And I spent many years early in my career sort of just serving in that education role of wanting to reach out to young, specifically Latinas, but young women of color who maybe didn't feel like they had someone they could turn to ask questions about their sexuality, about contraception. And when we spoke earlier about a rewarding career, it's been incredibly rewarding for me to feel like I've advocated for women's health, and particularly women of color, and hoping to see some change. I can say that in the small communities where I've worked before, I've certainly felt like there has been some change, but much greater change needs to happen for sure.
I definitely agree.
Yeah.
Dr. Davidson?
I would I would very much echo what Dr. Melendez said about education. Or about being an educator. That's really how I would see myself in this space in relation to working around period poverty. Unlike Dr. Melendez, I grew up in a dominantly white culture with a family that was very open about talking about female anatomy and sexuality. And I've always had a very open relationship with my parents. And in my personal experience, Dr. Melendez kind of mentioned where she came from. I grew up in a fairly conservative and very white area of rural Oregon, and saw many of my high school classmates experienced teenage pregnancy, some of whom dropped out. And it was one of the motivating factors for me to pursue a specialty in family planning. And I saw a lot of of young women sort of not knowing about not only not knowing about their body, not knowing about your period, and getting embarrassed about your period is one thing, but when you don't understand how that can translate into pregnancy and the life that ensues after a teenage pregnancy can be extremely, it's life changing. And so I really saw myself as somebody that kind of really that wanted to work in that space and work around education, around anatomy and around reproductive justice. And I will say that I do very much ascribe to the philosophy of reproductive justice. And we do see lots of teenagers who are pregnant, a minority of them by choice, a majority of them unintended. But we do work again as OBGYNs to give people that choice to decide, to become teenage moms as well. So, and we work to support them in that role. And talking to them about sexuality as a teenage mom, and also talking about their own children. One other space that I work in is around women who use substances in pregnancy, and we do a lot of counseling in that world about how to talk to your kids about sex, and how to make sure that girls are safe and have autonomy over their own bodies, and what is it like when you don't have the ability to control your sexuality. And I mean, it kind of just feeds into so many different issues that come up in life. And so I find myself in a huge part of my career working in that space of an educator.
That's incredible. You two are so inspiring. There's just so many things that a physician is to their patient, right? You are not only an advocate, you are also a teacher. You are also a friend at times when, you know, a patient is very...
Oh, I'm sorry.
Oh,
I'm also
so
a mother. So
hello.
sorry. Go downstairs. Excuse me. I'm just going to pause for just a second. And
You're totally fine.
Yeah.
But as I was saying, you know, just being a physician, you are encompassing so many other roles other than just being a physician. Just in terms of healthcare, there are so many other facets that may not only just affect menstrual equity or period poverty, but also mental health. But this is an entirely new tangent that I'm just going on. I'm just gonna finish or wait till Dr. Davidson's good.
Looks like she's back.
I'm
All
so
right.
sorry.
No worries.
Also a mother. Yeah.
Yeah, so as I was saying, in terms of healthcare, where do you guys see flaws in terms of just menstrual equity and period poverty and simple access to healthcare for menstruators?
I think, you know, one of the nice things that I've seen just daily living is, you know, schools providing sanitary products within like middle schools. Like I've actually read about some area schools here in Portland where they're offering, like those are opportunities for students to have access to them if they don't have them at home. And I think that sort of destigmatizing the need for those products, the fact that they're around, like just have them in a bathroom and not like bat an eye about it. I think that's really lovely and important so that we remove the shame from that aspect. I think where healthcare in general, I mean, I think pushing our state governments to remove taxes on sanitary products is something that I know our College of OBGYN has worked towards, but unfortunately it's a state by state effort. But I think that is an area where we as healthcare providers can lend a voice to advocacy to remove those barriers. I think I read something about, you know, men's shaving products don't get taxed, but
Yeah,
our sanitary products do. It's just really sick. So I think that for me, when I think about, you know, why I have patients that have arrived to my office appointments in the past with wadded up toilet paper between their leg, it's because they couldn't afford the box of pads or tampons or whatever. And that to me is just absurd that they don't have that access. You know, they can't use their government assistance to pay for those products. And that doesn't make sense to me. So I would advocate for that. I think even within like co-pays, you know, or with patients have insurance, being able to use their, you know, health savings account money for those products, things like that. That I think that's where they're small, but those would be steps that I think could be easily undertaken.
definitely.
I agree. I would agree with everything that Dr. Melendez said. And the other thing that I would say that we sometimes do is we help people take their periods away. people come in now and they are looking for contraception or they have bothersome periods, and we as healthcare providers are able to talk to them and explain to them that it's with manipulation of birth control pills or IUDs. There's other ways that people actually don't need to have a period for their health, and it's very safe. It's and it's healthy to be able to take periods away as well. And so I do that a lot in my job.
Oh, definitely.
And of course, people need access to healthcare in order to have to be able to pay for their birth control or to be able to pay for their IUD. So it's not a totally free option, but insurance oftentimes will pay for that, or public insurance.
Right. Well, in terms of COVID, how has this pandemic changed your work ethic as a OBGYN?
Dr. Davidson, I'll let you, I realize I've been starting all of the answers.
Oh,
Go, you can start.
Yeah, no, it's nice. I get to kind of just agree and move on. Well, I would say I mean, on a day-to-day basis, so we've done a lot of work virtually, and I think that has been beneficial for many people. I also know that there are a lot of people who don't necessarily have access to virtual care just because maybe they don't have good internet connections. And so I've experienced a lot of frustrations trying to connect with people who their phones are cut off, or they don't have video access to do our video visits. And so I have seen a lot of that sort of problems connecting with people. We have seen an uptake in our abortion clinic. People have, people have been making I guess there's a couple things that happen. A lot of people are home, and a lot of people are experiencing more unintended pregnancies. And a lot of people are saying, you know what, I'm not sure in this day and age, like in this situation, that I'm ready to bring a child into the world. And I have job insecurity and housing insecurity and food insecurity, and I don't even know what the schools are going to look like. Like, this isn't a time to be pregnant. So I've seen a lot of that. And also, particularly in the work that I do with women who I had mentioned who have experienced addiction or who have substance use disorders, that addiction is a disease of isolation. And we've really seen kind of an uptake in referrals in that realm since COVID, because I think people's typical coping strategies have really been kind of frazzled and worn thin, and people are really struggling just with the isolation that they're experiencing. And so we've seen a lot more of those referrals, and I guess there's been some positives too. I mean, we've been able to turn our groups virtual, and we've seen some more participation in some of the work that we do as well, because the opposite is also true for some people who have trouble with transportation, or who are too busy to make it into the clinic, or are much more able to seek care virtually. So I would say there's both aspects, just from a physician standpoint.
Yeah, and for me, the only things that I would add, I think everything that Dr. Davidson has said is obviously true, and I would also add that for our medical staff, our nursing staff, our physicians, everybody working in the hospital, where that never stopped. People continued to come in person. There was no option to do virtual care. There have been, the resilience that has sustained us throughout all these months. That's wearing thin as well, and so you see where we attempt to lean on each other, but obviously not physically. It has to happen happen virtually. It has to happen through just notes and messages to each other of just, keep going, you're going to be fine. And we all just sort of have this sustained hope that we will be fine at the end of all of this. But it gets harder and harder when we sort of have to continue working at this pace without an end really in sight just yet. So I think the reality is that we're all vulnerable, right? The physicians in charge of taking care of the patients are really just as vulnerable as the patients themselves. And I think that that reality has hit some of us quite hard. Yeah.
I definitely see that. Just in terms of the way you guys are speaking right now, I can tell there's so much strength you need to be working in the medical field right now, especially with everything going on, not just like daily tasks. How do you keep up that hope? How do you keep up that resilience that you wake up every day and you're like, I'm going to be the badass physician I am today that I made myself to be?
Well, I will say that I feel very thankful every single day to have a really, really awesome job that I can go to work and say, you know what, I really believe in what I'm doing today. So for me, I feel very fortunate and privileged to have that. And I will say that we have, like personally, it being a physician, you see the best and the worst of people, and it really gives you a lot of perspective on what you're dealing with at home. And I think that my job itself allows me to really, really have that perspective, and to see really deep and intimate experiences in people's lives. And I think it just adds a lot of perspective, and I'm able to go to work and have intense experiences and then come home, and it makes me feel even closer to my kids and wanting to be very present in the moment, because you just see how fragile and how complicated life is. And if you can't just be right there and try to make the best of it, then we have a big problem. And then I'll say that like when I see what people are going through in their lives, and I see kind of my more first world existential problems that I feel like I have to deal with, it really makes me very thankful to have my life. And so I'm always inspired by people's resilience and what people everybody else who gets up every day under much harder circumstances.
Definitely humbling.
Absolutely. I think that that's the perfect word for it. Ashka is very humbling to experience the grace that some patients will offer us when we feel like maybe we don't deserve it after an unexpected outcome. That to me is just awe-inspiring and beautiful. And like Dr. Davidson, I wouldn't trade what I do for anything else. In spite of the hardships we've encountered over these last few months with dealing with the pandemic, it is it's a great thing that we get to do every day, and I don't take it for granted at all that I'm able to occupy that space. And I will say, as far as what gets me up in the morning, it's no I'm so privileged to work amongst an amazing group of physicians. And, Dr. Davidson is one of my partners, and I love that she's doing this tonight. I think it speaks to sort of her commitment to caring for our very vulnerable communities. And I think that knowing that I get to work with people like Dr. Davidson every day really allows me to like sort of just get up and get back at it again, especially after a rough day or a rough night.
Ditto. Thanks, Dr. Melendez.
I've just got to say, I know I've been saying you two are inspiring and it's awesome, but I truly, truly believe that, when physicians and healthcare workers, they thank the communities, they come out, especially during this time, a whole new gravity to the situation. It's completely humbling to see you two just fighting along frontsiders, holding each other accountable and keeping each other up like that. The camaraderie is beautiful, and it's just so inspiring. I've probably said that for the 100th time, but it's just great to see you two like this.
Well, thank you. And we appreciate the work that you're doing as well.
For sure.
Thank you.
We work
Thank
on
you.
an individual basis, but getting these big, really important issues out in the community and advocating for marginalized communities is super, super important.
Thank you. Yeah, it's a team effort. It's definitely something that needs to be addressed ASAP. Well, going back to that, especially with COVID, do you see any disparities with period poverty just with the pandemic itself?
Absolutely. I mean, I think COVID has kind of laid bare how fragile so many systems in our society are. And I mean, we see, I have patients who basically like can no longer go to work because their kids can't go to school, and now they've lost their jobs and they are at risk for losing their house because they can't afford to pay. I mean, all of the spiraling problems that initially are hit poor communities or poor individuals are only being exacerbated by this problem. And there's absolutely no question that it has really made people already vulnerable so much more vulnerable. And we also know that it's really affected people of color in disproportionate amount than white people. And that's heartbreaking.
And we even, I mean, I think that even people that wouldn't have considered themselves poor before all of this happened very quickly have seen changes to their lives from, you know, a week to the next, where the job that they felt was secure, they'd been at for years, is no longer available to them. It no longer exists. Or we've seen communities, you know, whole communities who have had to continue to work in spite of, you know, unsafe environments and exposing themselves to the virus because they couldn't afford not to work. And so I think that specific to period poverty, I think anytime we remove an opportunity for women, and particularly young women, to access care or to have the means to get those sanitary products, or to have a home to live in, a bathroom to go to. I mean, anytime we mess with that, we're going to see an increase in period poverty. And this pandemic has certainly disrupted all of those safety nets that I think many people were grabbing onto, and some people who didn't need them before certainly are finding themselves needing them now.
Absolutely.
Yeah, for sure. Of course, like our motto is, periods do not stop for pandemics. It's the reality that we all have to face, unfortunately.
Yeah.
But with that said, in terms of period, where do you see the youth activists come to play with period poverty, or just any issue of menstrual equity in general?
I think the fact that you're here is amazing. The fact that we're talking about this is amazing. It's not something, certainly wasn't a conversation I was having in college, you know, when I was in, you know, the fact that you're holding on to it. We have a male member of the team. Like, that's, how awesome is that? We have, you know, a man at the table recognizing and understanding why this is important and advocating for it. That blows my mind. I have to say, I'm so proud to be a part of this right now because of that. And for you guys to be pushing that envelope, I would say continuing to make those uncomfortable spaces no longer uncomfortable, right? Like, making it a conversation that people can have. You know, I'm raising 2 boys right now, and I don't want them to be like, ew, you know, like about
Of course.
that rite of passage, that event that happens in every woman's life. And they probably have more information than their peers do at this point, but that's okay. We'll just roll with that. But yeah, I applaud the work that you're already doing, and I just say, take it to the high schools. You know, get the younger groups of kids involved, middle schools. You know, where these young girls are really struggling with where their place is in society, and I would say that starting them early and earlier is probably what I would advocate for.
Yeah, I would say the same thing. You guys are really kind of breaking ground with this organization and getting the language out. Like, I would echo what Dr. Melendez said, that I don't think like 15 years ago, period poverty was even a thing. It was even a word. And the fact that we now have language to describe a very complex issue that affects millions and millions of people around the world is really awesome. And so continuing to bring this into the conversation, continuing to normalize these ideas among your peers and among younger kids, especially for girls who might not have the education coming from home or from schools, is super, super important. And I'd say, you know, like wrapping it into the bigger social issues that are going on right now in our country. I mean, it is about autonomy, and it's about justice, and it's about women and girls' rights and their rights over their bodies and their rights to be out there in the world, and not being dominated by a different class. So I think you guys are just doing a really awesome job at bringing this issue to the forefront of our consciousness. So
I
yeah.
definitely agree. Yeah. Well, thank you both for being here. It's been an incredible experience speaking with both of you. I think we've got a ton of insight, especially through the healthcare system. I know this is definitely, this still is a taboo issue that I remember one time a physician actually asked me, instead of saying period, he just simply motioned and said, how's that going? And I was completely appalled. Like, why? You have an MD. But either way, I think there are so many ways that the healthcare system plays a huge role in period poverty, and it is awesome that you two are bringing up that forefront and that foundation.
Thank you.
Yeah, thank you.
So much. All right, it was great to have you.